Hey everyone, welcome back to my channel. So I received lots of positive feedback on my other ethics video, so I figured out some people want me to make a series or like a playlist. So here's another episode of ethics, and here I'm going to talk about the physician-patient relationship, and I'm going to walk you through questions, show you how to solve them, and give you like clear-cut principles or ethical principles to follow so that you can actually follow the same lead and the same pattern to solving these questions if different scenarios come up. And we're gonna do 4 questions together, so let's get started. All right, so the first question says, a physician in a busy inner city environment has developed his practice over the years to the point where he no longer needs to solicit new patients. So his practice is essentially full, so he doesn't need income of any new patients. That is, he does not want to expand his hours of work, so he decides to limit his practice to just the hours he's working at, and he wouldn't accept any other new patients. So he instructs his office staff to begin refusing to accept new patients. All right, so what do you think of this act? Which of the following most appropriately describes his action? Is it ethical? Is it legal? What is it? If you refuse to accept new patients, not on the basis of anything, you just refuse to accept new patients because your hours are full, or you just don't wanna, or maybe because it's beyond your area of expertise. For all of these reasons, it is neither unethical nor illegal, so it is perfectly fine, both legal and ethical actually, as long as you do not refuse to accept them on the basis of race or religion, or on the basis of disease status. For example, if a physician rejects a patient on the basis of HIV status, then this is considered unethical. All right, if you refuse them on basis of HIV, on basis of race, on basis of religion, stuff like that, then it's considered unethical, but it's still not illegal, by the way. All right. Now, what about the other answer choices? It is ethically acceptable, illegal? No, it is legal and it's ethical. It's because his hours are full, so he doesn't need any more. He's within his legal rights to refuse patients, but it is considered ethically unacceptable. Nope, as we mentioned, it's only ethically unacceptable if it's on the basis of something. If it's because he's only refusing HIV positive patients, well, this is unethical. All right, it is both illegal and unethical to refuse. Nope, it is ethical as long as he arranges transfer of care to another physician. Well, that will be a courteous act, but it is not required of him to do that. And this, by the way, this point is a little bit confusing because there's another scenario about that, by the way. So this case would apply if the physician already had a relationship with a patient, and they want to stop this relationship for some reason, and then in that case you have to transfer the patient to the care of another doctor. No physician should stop the physician-patient relationship without transferring the care to another physician. Otherwise, this will be known as patient abandonment, and this is unethical. All right, therefore this is not the same as not accepting new patients, because in this case, this would be the case if you have already started a relationship, a physician-patient relationship, and you want to stop it for any reason. In that case, the physician-patient relationship has already started, and so you cannot stop it without guaranteeing that this patient is gonna go to the care of another physician. In that case, it is your duty to transfer care to another physician, and it is unethical if you don't. However, here he is not accepting new patients in the first place, which means the physician-patient relationship hasn't yet started. And so what he's doing, because he's not accepting new patients regardless, not on the basis of anything, not on the basis of religion, race, HIV status, or anything, or any disease status, then it is both legal and ethical. All right. Moving on to the next question. You have a patient who has recently been diagnosed with myeloma, and he's discussing treatment options with you. You are the full-time employee of an outpatient facility run by a managed care plan, and you have recently received written instructions not to bring up subjects such as bone marrow transplantation in myeloma with patients. So your employer or whoever is working in this clinic instructed you not to bring up this topic because the reasoning was that they're outrageously expensive and do not cure the disease, although it may extend survival. So the thing is here, your head is asking you not to mention bone marrow transplantation as a treatment option to myeloma patients because it's expensive and it doesn't cure. So they're asking you to withhold information. All right, so what is your take at that? Especially that if I continue, it's saying the data that they extend survival are not entirely conclusive. In addition, in a private meeting with the medical director, you have been told that the expenditures per patient load of care of each of the physicians will be examined yearly to determine which physician will be promoted, which means that they're probably telling you not to mention this treatment option that is very expensive, because if you did and the patients decided to actually choose bone marrow transplantation as an option, which is very expensive, then it would be counted on you, because there is something called expenditures per patient load of care of each physician. So you would be the physician who's costing them a lot, in other words. And so there is some politics behind it, you know, and therefore the end result of all this, like what the question is trying to tell you, would be, are you gonna withhold information just because your medical director told you to, or are you gonna be on the side of the patient and inform them of everything? That's essentially what the question is asking. All right, so what do? Do you withhold information and listen to your manager or whatever, or do you inform the patient fully of all the treatment options? Obviously, the right answer is to fully inform the patient about the risks and benefits of bone marrow transplantation. It is essential for a patient to make an informed consent. Okay, they have to be informed. The patient has to be informed, fully informed. Okay, so all treatment options should be outlined. So you don't just inform them of the risks and benefits of the mainstream treatment option or the current option. You inform them of all the options, and that is an essential part of informed consent. And I might make another video on that. In that, informed consent doesn't just include, for example, surgery has these risks and benefits and that's it. This is one option. You didn't tell me there is a medical option other than a surgical option. You didn't tell me there is option C. Okay, so I understand there's option A with risks and benefits, but you have to tell me option B, option C as part of informed consent. Otherwise, I wouldn't be fully informed, right? So that's the thing. And so beneficence of the patient always outweighs whatever you're instructed with in your in whatever place you work in. All right, so let's take a look at the other options. Refer your patient to an oncologist, to have this discussion, well, you can do it on your own. I don't think you need an oncologist to discuss treatment options. So yeah, transfer the patient to another primary care provider. Just because you don't want to mention another treatment option, you're going to transfer the patient entirely. This seems very illogical, actually. Advise the patient to file suit against the managed care plan. Here you're going against your own good, because now it's like you are actually suing your employer, so, or advising or encouraging the patient to do that. Give the patient treatment with melphalan or thalidomide. Again, guys, I want to stress this out. A lot of questions on the boards will try to confuse you, like by mingling in an inadequate medical treatment inside the answer choices, just to avoid an ethical dilemma. Don't fall in this trap, all right? So don't accept an inadequate treatment option just to avoid an ethical dilemma, all right? So obviously that would not be enough for myeloma, or just that's probably, again, it's not solving the problem of having to inform the patient of all options still, right? And finally, inform the patient about bone marrow transplantation if he asks you about it. What if they don't know? Patients do not know all the options, and it is your duty to inform. And so beneficence of the patient is always comes above any instructions you're given, all right? So fully inform the patient, of course, fully inform the patient. Don't betray your medical responsibility, okay? Right, moving on to the next question. You have a patient who is a 57-year-old man with a history of HIV who has recently been found to have severe coronary artery disease. He has 3 vessels with more than 90% occlusion and left ventricular dysfunction, which means that he's in dire need of bypass surgery, which is why he's been referred for bypass surgery. The cardiothoracic surgeon at your hospital refuses to operate on your patient because he's scared of touching HIV-positive patients for fear of seroconversion. This is very similar to the case I mentioned in my other video on ethics as well, that a lot of physicians might refuse to treat HIV-positive patients. And again, it's a very similar question. What would you do? And the patient's on a beta blocker, ACE inhibitor, aspirin. The thing here is, again, the boards will try to confuse you with a less than adequate treatment. They're probably going to replace surgery with a medical treatment, even though this patient is in dire need of surgery. No drug here can replace bypass surgery because this patient has 3 vessel disease. And so I cannot accept a low quality treatment option just because this surgeon I'm referring him to refused to care. All right, so he's not the last surgeon in the world, is he? Right? So there is other cardiothoracic surgeons who would hopefully agree to treat this patient. Now, what he did, I want you to remember with me from my other video. What this cardiothoracic surgeon did, was it illegal? No, it's not. Is it unethical? Oh, yes, it is. Why is it unethical? It's not unethical to refuse a new patient. Just to refuse a new patient, I just don't want patients. It's not unethical to do that, but to refuse them on the basis of HIV status alone, or on the basis of color, or on the basis of religion, or whatever alone, then that is unethical, okay? But it's still not illegal, by the way. So what he did is unethical, but that's not our problem now. What you should do is not to accept an inadequate medical treatment as an alternative to surgery. So add calcium channel blockers. They're still not gonna solve the problem, right? Angioplasty and stenting, add clopidogrel. All these are distractors that would want you to choose an inadequate medical treatment in order to avoid an ethical dilemma, when indeed they're distracting you from the entire point of it, that this patient needs bypass surgery. Okay, this patient needs bypass surgery. Now, have his chief of service compel him to do the procedure. Nobody can force a physician to enter a physician-patient relationship with a patient, and no patient should be forced to enter a physician-patient relationship with a doctor. It works both ways. It works both ways. No physician should be forced, and no doctor should be forced. All right? No matter who's forcing them, whether it's chief of service, whether it's the president himself, nobody. All right? Refer the patient to another cardiothoracic surgeon is the correct answer. Okay? Anyone who can accept them. Finally, a 60-year-old male physician who is an internist has had a female patient for the last 20 years, so such a long period actually. Both lost their spouses several years ago. They start spending time together outside the office. Now, the female patient wants to begin a sexual or romantic relationship with the physician. What should he tell her? Now, this thing is concerned with romantic relationships between a physician and a patient, as the normal notion goes that you cannot have both relationships at the same time. Like, you can't be her doctor and her boyfriend or husband at the same time. So one has to end. Either the physician-patient relationship has to end before starting a marriage or dating or whatever other romantic relationship. Okay, so those can't go together. So you need to end this before starting this. Okay, that's if it is a physician-patient relationship. However, if it is a psychiatrist-patient relationship, so if this is a psychiatrist and a patient, it can never happen regardless. They can never, even after you end this relationship, they can never have a romantic relationship, even after you end the psychiatrist-patient relationship. And so it's different for psychiatry because things get a little bit sensitive. Imagine even after ending the psychiatrist-patient relationship, he literally knows everything she went through, depression and stuff, I don't know. And so they might hold it as, I don't know, it's like shame or stuff like that. So it doesn't work given the sensitivity of the information shared to a psychiatrist. That can never happen. But it can happen with an internist. He's actually that's why he's highlighting here that it's an internist. It's okay if it's a doctor, and as long as you end this relationship and refer her to another physician. You should not be her doctor, okay, to avoid abuse of that relationship. Imagine if he, for example, had a fight with her and then he's not going to treat her anymore. What's that, right? So there has to be a line, okay, a certain line between your physician and your husband. All right, so he has to end the relationship first and then transfer her to another physician before they can have a romantic relationship. All right, so what should he tell her? I can never do that with you ever would be the case if he was a psychiatrist, but he actually can. You can do that with her if you end the physician-patient relationship. We can be social but not sexual. We need the ethics board's approval. All this is wrong. And actually the ethics board's approval, it's not a dating service, so it shouldn't go in such issues. Actually, I cannot date you and be your doctor. It can't be an and, it's or. Okay, it's I'm either your doctor or your date. I can't be both. All right, maybe in the future we can date after you get another doctor. So this is the third condition. So the first condition is to end the physician-patient relationship in order to date. The second condition is to get another doctor. Both have to occur. All right, guys? Because this is your initiative, we can begin dating. It doesn't matter who starts, whether he starts or she starts. The physician-patient relationship has to end before they can date. All right? I hope this is clear, guys, because this whole physician-patient relationship topic gets a little bit confusing. So I hope this video helped, and let me know what you think in the comments. All the best, guys.